Let's make sure that, okay, we are live on YouTube.
And I let Tony know we're back and open.
Or not.
Well, we're getting there.
All right. All right, so the next item we will take is the action from closed session, if any, which I believe would be COVID-19 emergency operations planning update.
Yep, I can provide that update.
Please.
Okay. Ever since this pandemic began, we closed facilities at the Park District, and on March 13th of this year, the Park District quickly adopted an emergency response plan that complied with all local, state, and federal and CDC guidelines, which were aimed at, of course, the health and safety of all of our residents and users of the Park District. We've had three goals throughout this entire pandemic. The first and most important was our emergency planning efforts to ensure the health and safety of our employees, patrons, and community. Secondly, we've consistently focused on our strategic planning efforts for the delivery of essential programs and services that meet our mission for enriching community life through healthy leisure pursuits. And then also being fiscally responsible to ensure responsible management and stewardship of our community resources, including our parks, beaches, facilities, and all of our mission critical services. As of recently, we are obviously have been made aware today, both locally and in our state, about the exponential increase in positivity rates for COVID-19. And also the increase in hospitalization rates. Therefore, the mayor gave a resolution today, and shortly after, the governor gave an order for mitigation efforts to move into Tier 3 for the entire state. And with that, there were some minor differences with the resolution from our local entity and the state. Obviously, staff has spent a considerable time reviewing and understanding the different orders, as well as reviewing and understanding where those orders were based from. And I would like to just provide an overview and recommendation of what staff is recommending. And I will also say that as a park and recreational professional myself, who's been in the industry for over 20 years, and our team, who obviously has been in the industry for a long time, we are here to serve the mission of the Park District. We are here to serve the community, to enrich community life through healthy leisure pursuits. And our highest value in doing so is to ensure that we do it with the health and safety of each patron and individual that visits our facilities and lives in this community. The major difference between the two orders was in regards to the Health and Fitness Center. Again, we are obviously, our mission and our strong belief is that recreation and fitness is essential. Specifically fitness for the emotional well-being as well as physical well-being. And there were many studies that we've also looked at regarding the importance of allowing people who have essential needs to exercise to be able to do so in a safe environment. And it is with that that the staff is recommending that we follow the governor's order, which also does comply with the resolution locally, with the only difference that we would make the fitness component of our recreation center available to no more than 10 people at one time in our facility, which is over 55,000 square feet in size, as well as permit 1v1 personal training. Those are both recommendations from the governor. And those are recommendations that staff would like to present to the park board for their consideration as well.
Thank you. Is there a motion? Are there any questions from the park board? or
I
commissioners?
I have one question. May I mute? I don't know what I'm, okay.
You're
Do we have the ability to take public comments on this? Is there anybody from the public who wants to speak on this issue?
So there has been no public comment, and we do not have the ability to take public comment. Our public comment procedure due to our streaming platform is to take public comment via email on agenda items prior to, and I did not receive any.
I mean, is Councilman Bloomberg on the call right now?
I don't see him.
So the answer is no.
He is not on the phone at the current time.
Scared him off. Nope, he's not there.
Okay. I mean, if it was possible, I'd like to get the city's perspective on this, but obviously, you know, we are unable to do that.
Well, Cal, the city's perspective is that the mayor issued the executive order, and it is what it is.
Okay. Okay, I understand. I mean, I still like obviously Councilman Bloomberg's the liaison. He's unable to participate he's not on the full call right now. So, all right, that's fine. I'll move on.
All right, are there any other questions? Hearing none, is there a motion to approve the proposed operational plans for facilities and programs, so long as the governor does not mandate an emergency closure for the state of Illinois? Or that's the motion. It's to basically adopt what Brian has presented, consistent with the governor's order.
So moved.
Is there a second?
Second.
All right.
Discussion. Yeah.
Yes, discussion. I would like to start the discussion by offering an amendment to the motion. And it would be to comply with the governor's current order and the proposed operational plans, except that the recreation center follows the mayor's executive order. So there is an amendment on the, is there anybody who will second the amendment?
Will you clarify that? I'm not sure what you mean by an amendment. It's either one or the other, no?
Well, we have a motion to approve following the governor's to do the staff recommendations, which are consistent with the mayor's order and the governor's order, except the governor's order allows us to operate the recreation center on a significantly limited basis. The amendment would be to do all that, except we would follow the mayor's order and in essence, close the rec center. And I've offered the amendment. And if we have a second, then we can take a vote on the amendment.
Yeah, so if I'm understanding correctly, you're saying, I believe that I'm in favor of the amendment where we do close the rec center at the mayor's request.
If I can, oh, sorry.
Go ahead.
I'll let you finish your discussion. I wanted to let you know that I believe Councilman Bloomberg is on the phone, but I'll let you finish your amendment.
Oh, okay. Well, we have
Tony is back in.
I'm sorry.
Tony is back in.
Okay. So let me just restate. We have a motion to approve. This is for Tony's benefit. Tony, are you able to communicate with us?
He may be muted, Brian, no?
He is muted.
I don't know
Can
if
you hear me
Dan
now?
Austin.
Can you hear me now?
Yes.
Okay, great. Thank you.
So let me just bring you up. We have a motion to basically I'll summarize it. Basically, close the facilities except for the rec center. We have an amendment to that to include the rec center in the closure pursuant to the mayor's executive order.
I believe
Okay.
the motion was to adopt the tier 3, the governor's tier 3 order. I think that we should be precise with our language.
Okay, we'll be precise with the language. Brian will put it into the correct terms. And
Yeah, okay.
before we go any further, Cal asked if there was anybody from the public / you who would like to speak to this topic, so he has the full input. Am I correct, Cal?
Correct. Thank you.
So
Thank you.
that's where we are. And Tony, if you would like to, add to the discussion, we'd appreciate it.
Okay. I'm not sure why you would not comply with the more local order of the mayor. My understanding is that the state order is in place except where local orders are more stringent. And in this case, the mayor's order seems to me to mandate the closing of the rec center consistent with the closure of similar privately owned facilities.
I believe that's correct. And I will add that our executive director did have conversations with legal counsel on that topic. And what we were, I would appreciate any more thoughts you have. And then maybe we should have a dialogue with Tony while he's available.
I'm happy to do that. I will briefly state that we in this area of Illinois are experiencing an even more advanced increase in COVID-19 cases beyond the state, and the state is experiencing what can only be described as a loss of control over the pandemic. We have hospitals in Highland Park that do not service COVID patients. Highland Park Hospital transfers their COVID patients to, I believe, Glenbrook, but they process the patients through there. And because of this, those facilities are rapidly becoming overwhelmed. You are about to have a large population returning home from college. I would say that's somewhat ill-advised. There were 177 new cases just this weekend alone. And while I deeply appreciate everything that the Park District does and trying to provide facilities for people to get out, this is not the time to get out. It is difficult enough that people are going to be coming home for social activities and hopefully preparing for that. But we know from news reports that different colleges are inconsistent in how they've handled it on campus and how kids are being released to come home. I think, I don't mean this in a derogatory way, but it seems to me somewhat irresponsible to keep the rec center open. And by closing the other facilities, you've acknowledged the heightened problem that we are currently facing. We've got to get this under control. I can tell you the city council today faced a fair amount of pressure from some sectors of the public, although generally the public is supportive and understands this. It is not something that anybody wants to do, but I think it is our responsibility as elected officials. Our number one responsibility is to protect the health and welfare of our residents. So I would like to see you close the rec center.
Does anybody have any questions for Tony?
Yeah,
No.
I have a question. I have a question for Tony.
Okay.
Tony?
Yeah.
Councilman Bloomberg,
Yes.
excuse me.
You can call me Tony.
Okay, thank you. Was the city's decision to issue that order resolution, was that done based in consultation with any, lack of better words, scientists or anybody who specializes in the field with regard to this
Absolutely,
issue?
yes. And I believe it's referenced in the order. It was done in conjunction with the Lake County Department of Health and the other scientific sources that also support the governor's order as to the state, and the more specific orders as they apply to the city of Highland Park or any municipality that is facing a more substantial increase than the state is. So principally through the Lake County Department of Health and the resources that they rely on.
So did the Lake County Department of Health recommend that all fitness facilities throughout the county be closed or just in Highland Park?
I'm not sure I know the answer to that. I know it would apply to Highland Park. I'm going to see if I can get an answer to you. We also have relied on the Infectious Diseases Society of America in general underlying the mayor's order. The information from the Lake County Health Department, however, is not necessarily a recommendation as to which facilities to close, but to provide the science and to provide the measures that are necessary at each step of when this pandemic becomes increasingly difficult to manage. So with respect to the city of Highland Park, we're relying on information from the Lake County Health Department in order to know what we should do locally.
Can you
And
explain?
based on the increase, I'm sorry, Cal.
No, go ahead, finish.
Based on the increased number of cases specific to Highland Park, it was appropriate to take more aggressive measures than the rest of the county.
And in turn, the rest of the state.
Well, the measures that we're taking in Highland Park are more aggressive than in other parts of the state because we are experiencing a greater surge than other parts of the state, although the state has become more stringent because the state is generally experiencing a surge.
So what's the difference between the surge that the state and is incurring at this point and what the city of Highland Park is?
The number of cases per capita population.
Do we have that information?
I don't have that information at my fingertips, but my understanding is that the increase in Highland Park has been more dramatic than other parts of the county and other parts of the state. My suggestion is that you close the rec center, and if it appears that in fact Highland Park is not experiencing as drastic a surge, then you could reconsider at a later time. But I think frankly, this is a time to be conservative in the other direction and to limit activities and interaction. I don't operate a rec center, but I will tell you, because I used to work out in a private similar facility and I used to be in the rec center. These are facilities that are hard to maintain the level of safety that is really required right now. You can't exercise with a mask on. And the contact with equipment, the amount of wiping off, and the amount of interaction between people, I think anecdotally strikes me as pretty risky.
Can I jump in for a second?
Sure, go ahead. Go ahead, Tom.
Well, you had me until right there because, again, following the science and what we're hearing, from what I've been told by our executive director and everything like that, is that actually it is a lot lower to be getting it at a rec center than it is in many of the other places that are seemingly either are still being open or are being only urged to shut.
And I,
So you may have a, I'm sorry, Commissioner, Councilman Bloomer, you may have a feeling that these things are hard to tackle or hard to handle, but our staff, especially given the few number of people that we would be accepting there compared to the space that we have there. And Brian Rome's, correct me if I'm incorrect, but it seems to me that we can actually mitigate the issues that would seemingly be a problem, but maybe scientifically aren't a problem.
Well, I would say this, consistently since the onset of the pandemic, gyms, bars, casinos, and cruise ships are identified regularly as some of the more dangerous locations. I do know that that our city in particular has had a far more dramatic rise in cases than the rest of the county and the rest of the state. And for that reason alone, that's why this order was put in place by the mayor.
Barney, can I ask a question? Are you done, Terry? I'm sorry.
Well, I was just hoping that Brian could put his finger more, accurately on what I was.
Well, can I respond to that?
Sure. Yeah.
Because as we've been talking, Councilman Bloomberg, I respect your opinions and your numbers, but I went to the website for the Illinois Department of, let me get the name right, the Public Health. And there's a wheel on here that lists the percentages of people that catch it where. Gym or health club is 1.75%, while home is 3.12%. And I can tell you from personal experience from being a rec center user, it has worked with masks. I've seen everybody is social distanced, and everybody is clean. It is clean both before and after they've gotten on machines. If anything, we're going through too many antiseptic wipes. Tony,
So
I'm not here to question you. I know where your interests are, and I understand it.
So Brian, I respect that, and I appreciate your saying that. I'm going to refer to the Infectious Disease Society of America, which published a triplet. You've probably seen this published. It has categorized low risk, medium risk, and high risk activities, and color coded them with green, low risk, medium risk is yellow, and high risk is red. And the activities listed under high risk are going on a cruise, going to a crowded beach, going to the gym, eating indoors at a restaurant, playing high or full contact sports such as football or basketball, going to casinos. I won't read the rest of them, but you'll notice that the mayor's order addresses those that do exist within the city of Highland Park, specifically drastically reducing the ability to attend restaurants and closing gyms. And I will tell you, frankly, you're our sister government. I'd like to see you support this. We are closing private gymnasiums. I'd like to see you close your rec center. It's a dangerous activity based on science and based on public published information. I know you don't want to do it. I think it's the responsible thing to do.
Can I ask a quick question, Tony?
Fine. Absolutely.
No, I didn't know if I was muted. That's why I hesitated.
Brian, after you ask your question, Tony, respond. I know Lori has a question also.
Tony, I'm trying to find the study you're referring to. Can you just tell me when it's dated so I can find it?
I don't have the date, but if you go to idsociety.org/COVID-19, I can try and, I'm not sure how I'm going to copy this and get it to your phone.
IB Society.
Hold on.
And does
me see.
that study that you're talking about refer to individuals wearing masks or not wearing masks?
It just refers to the activities.
Okay. Now, would masks make a difference?
I think masks always make a difference. Here's what it says. The below activities are categorized assuming that face masks will be worn and that physical distancing of 6 feet or more will be maintained and people with underlying medical conditions are taking increased precautions. So the answer to your question, Brian, is yes. Those are considered the most dangerous activities while wearing a mask, while distancing, and while taking increased precautions if you're at higher risk.
And then what is it? I'm still trying to find it. Can you just give me the date? I apologize.
That's okay. I'm trying to just copy this and send it to you if I can.
While that's going on, Lori, do you want to have a question that you wanted to ask while they're researching this?
Nancy, thank you. Nancy sent it to me.
Oh, okay.
Thank you.
Thank you, Mayor.
Can you hear me, Barney?
Yes.
No, I didn't have a question. It was actually answered by Mr. Bloomberg.
Barney,
Yes.
I have a question. Councilman, with regard to the Governor Pritzker's order reducing this to tier 3, are you familiar with the what his order is with regard to fitness centers and health clubs?
I'm not specifically familiar with it.
I mean, from what I understand, and Brian, you could probably speak to this better than me, Brian Romes, is that from going from tier 4 to tier 3, the capacity is reduced from 40% to 25%. Is that correct?
It is reduced to 25%, but we're well below 25%.
So what are you proposing in the staff recommendation? What's the capacity of the rec center you're proposing at any given time?
Yeah, it's below 10%. So we're proposing that 10 people would use a 55,000 square foot facility at one time.
That's in the fitness floor.
Yeah.
Also, we're going to allow people in for individual training, correct?
Correct. They'd be in separate rooms. Let me rephrase, Barney. Thank you for clarifying. If you were to separate the rooms, the fitness floor and the gymnasium combined are roughly 20,000 square feet, which is where our fitness equipment is, and we're 10 people in that space. And then we have separate rooms for private training, which would be one-on-one. So it again is intended to address what, there's a lot of data out there, and obviously we're in full respect and understanding of the
Cal, we're hearing your other meeting.
Well, my other meeting. Yeah. Well, sorry, I missed it. I apologize.
Sorry, I was just answering the question on how many people in our facility. So the facility is 55,000 square feet. The area of the actual fitness is roughly 20,000 square feet, and we're looking at 10 people at one time. Again, all wearing face masks 100% of the time that they're there. And
So I'm sorry.
that's okay.
I'd like to insert here a couple of things. First of all, if you're reducing it that much, why don't you just close it? We're talking about a 30-day closure. Secondly, I guess what I'd like to ask is, has anybody gotten COVID at the rec center, to your knowledge, either employees or users?
So we have no data that says it was transmitted at the rec center. There have been, I believe, 2 employees who have gotten COVID, but they did not get it at the rec center. We know that they were contracted in other places, and we gave appropriate announcements for that. And really, you know, it's obviously this is a very delicate subject. You know, the only reason that the staff is making the recommendation is to go along with the recommendation of many physicians, including from the Chicago Medical Society, that, you know, as we know, health fitness is an important part of health for obviously building immunity, reducing stress, maintaining mental health,
Got that.
all of which are important aspects. But certainly understand this is, you know, not a black and white issue. But again, we certainly feel it's a very safe environment based on the information that we have available.
I understand. I understand you feel that way, but that is inconsistent with the information from organizations like the Lake County Department of Health and the American Infectious Disease Society, information that isn't specific to what measures to be used, but when to employ increasingly strict measures. And what I'm trying to impress is that Highland Park's increase in COVID cases is substantially greater than the rest of the state. So when Governor Pritzker puts something into effect, that's addressing the lowest common denominator of increase, and Highland Park is at very much the other end, which is why his order gives way to stricter local ordinances in home rule units such as Highland Park. So again, it's 30 days. You've already agreed to substantially reduce the use. It seems to me that the appropriate thing to do is the sister government to Highland Park and the sister government to District 112 and 113 is to close the gym for 30 days while we get through this very significant increase in COVID.
Tony, I want to,
Yeah.
let me jump in. I think your information is very helpful. We have due respect for the sister government. We have due respect for the emergency situation in the community. And one of the things that we haven't talked about is the enormous cost to us of running the recreation center for so few people. But we have, unless anybody has any other questions of Tony, we have a motion pending. And I'm just looking for guidance if we're prepared to take a vote on the amendment, which is the precursor. We have an amendment pending to adopt for the governor's, I'm sorry, we have an amendment to adopt, we have a motion to adopt the governor's order, and Cal will correct the words and implement the way it's been described. We have an amendment to that to implement the city's executive order, and the current discussion before we went back to you was discussion on the amendment.
In response, President Rudenberg, I know that, this is one of the drawbacks from having these Zoom meetings and not being in person, because obviously, if we can recess for 5 minutes and have one-on-one discussions and things like that that we don't, which is much more difficult in this virtual meeting forum. So I know that I'd like to talk to you if possible before we vote on the motion, and I would suggest that we recess for 5 minutes and discuss this. We could have a conversation, then come back and either make comments at that point or vote, but that's what I would prefer at this point.
Brian, how do we have the ability of putting this on pause for a few moments?
You mute your phones and you mute the video and you make a cell phone call.
Yeah, no, well, we can, if you make a motion for a recess and a second, and all in favor, we can take a 5-minute recess, and then we can take it off live YouTube, and then we can reconvene in 5 minutes.
And just remember that obviously there'll be no conversations that would violate the Open Meetings Act. There'll be not more than 2 commissioners speaking together at a time.
That's why I said cell phones.
Yes. So
Can
just
you
so you
put-
know, yeah, go ahead. Sorry.
No, go ahead. I thought
No,
you
I'm
were
sorry.
done.
I don't want to interrupt you, Mayor.
Lori?
No, I was hoping for clarity. Who's calling who? I'm just not sure who's on the call.
No, only 2 of us can talk at a time. 3 of us can't talk together because that would be a violation of the Open Meetings Act. So I wanted to give, I wanted to talk to some of my fellow commissioners before we vote on this, and then come back and vote.
All right, why don't we do this? I will entertain a motion to have a recess, that's the right word, isn't it? Until 10 minutes to 8? Is that enough
That's fine.
time?
Yeah, that's fine.
All right, Cal, do you want to move?
Yeah, I make that motion.
I second.
All in favor?
Yes.
All right, so we will reconvene at 7:50.
Okay, thank you. I'll call you up, Brenny.
Do I have to dial back in? Can you tell me, do I have to dial back in?
No, you could stay in and you could take off live. So Cal and everybody else should mute and turn off their cameras and turn off their volumes.
Okay, thank you.
And we'll